If we have not already met, I'm Dr. Eric Potter, Functional MD from Sanctuary Functional Medicine. If you're on a quest for a healthier, more abundant life, you're in the correct place. Succeeding on that quest in a world filled with a myriad of health options requires a special tool. That tool is called discernment. Or in simpler terms, you have to become your own best medical expert. Discernment means you must understand the available options offered by doctors, supplement companies, therapies, or pharmaceuticals so that you can choose the best fit for your needs. Well, you may have already heard me talk about the basic practices of discernment in person or on YouTube. Those are later steps in becoming your own best medical expert. First, you must know yourself, and that's what I want to help you with here. You must be an expert in yourself in order to help other medical experts do their best for you. If you don't know what you need, what you want, or what you have, how will you know if you find what you're looking for? If I've convinced you, then keep watching as I walk you through a little self-assessment. Begin with asking what you believe about reality. This sounds awful philosophical, but trust me, you need to understand what you believe about nature and if a supernatural world exists. If you believe in reality beyond the physical, you need to consider how you view their connection. Ask yourself if you see nature as ordered or random. Let me give you a concrete example. If you only recognize the physical aspects of reality, not a spiritual world, then you will want to lean towards a practitioner focused on biochemical testing and therapies. You'd be less likely to appreciate or benefit from someone who spends time discussing your emotions or spiritual beliefs. On the other hand, if you hold beliefs about the supernatural or the afterlife, you'll likely benefit more from someone who incorporates these important influences into their treatment plan for you. You'll likely want someone with a similar religious belief, especially if life and death decisions are involved. Next, ask yourself what you need or what are your goals for therapy. What result from that practitioner or therapy or product would make you glad you tried it? These are the core issues, not just desires or preferences, but make or break issues. Do you have a timeline such as 1 month, 6 months, or 1 year for recovery? You may be needing relief of pain. You may need a cure to prevent death. You may need the ability to work again. You may need help understanding nutrition. You may need help knowing how to exercise. Whatever the need, identify it both for yourself and so you can tell the doctor what you're hoping for from their care. You can then measure if your doctor or product met your identified needs. After that, think about what you want or hope for from the interaction or therapy trial. These are not the foundational needs, but still important. You may be willing to forego 1 or 2 of them, but still seek them. For example, do you want to understand the mechanism of the therapy? Do you want only natural therapies or only conventional, or options for both? Would you settle for relief without root cause answers or not? How much time do you want from the doctor? These factors will affect which therapy or doctor you choose. Then consider what you're willing to change and what you're not willing to change on your end. There are certain dietary options you can't live without: gluten, ice cream, soda. You're willing to spend 1 hour per week exercising if needed, 2 hours? What other lifestyle factors are non-negotiable? Alcohol, smoking, sugar, late night gatherings? Certain therapies or programs may require you to give up a non-negotiable. Maybe you should look elsewhere, or maybe you should give it up if it's for the best of your health. Be ready to face choices that include giving up some non-negotiables. What do you already have to contribute? Think about your resources. Do you already have a few things about nutrition? Do you have family support to carry out therapies with you? Do you have someone who will go to doctor visits with you? Someone to hold you accountable to diet or exercise? Do you have emotional and prayer support for bad days? Do you have the finances needed? Do you have any others who might help with the finances? You need to know what you bring to the recovery table or where you need outside help. This provides a very good foundation for first steps to restoration. Putting these on paper and maybe discussing them with a trusted friend or family member will solidify them. Then when meeting with your doctor or talking with a therapy provider, you already have your side of the interaction on solid footing. If you want to go a step further, you can further assist your healthcare practitioner with a few more preparations. Make a list of symptoms in order of importance or severity. Letting them know that your pain is urgent, but your cholesterol can wait, can save a lot of frustration for both of you. If you want to go further, then write out a summary of your health story. When our patients do this, it allows us to focus more on details rather than having to spend time gathering the big picture. The visits become much more productive. The final advanced step of knowing yourself involves even more effort, but is fruitful when implemented. Going into a practitioner visit, especially with a specialist with 1 or more articles about your condition, can focus the discussion quickly, especially if you've read those articles and are ready to talk with them. Do let the practitioner work through your story before requiring an answer, but do expect a response of some sort. If you're considering a procedure or financial commitment, having a deeper understanding of the proposed procedure is reasonable. Ask questions. Read something on the internet, find something besides a marketing pitch to share with your practitioner. Okay, catch your breath. This work is not a sprint, but an opportunity to reflect and prepare. If you're not ill now, take a few minutes to do a quick inventory and put it away for later. If you're facing present illness, set aside sufficient time so that you're best prepared with choices you're facing. If a loved one is ill, help them walk through this self-assessment. Many will claim they can help. More than one way may be fruitful, but not all. If you know yourself, you can meet the medical expert on you that can work best alongside whatever medical provider you choose. You can also better pick and choose from options online or in books or in stores. Become your own best expert by beginning with knowing yourself. This is Dr. Eckhart, Functional MD, helping you live a healthier, more abundant life.